All right, thank you for staying with the Monday Report. The conversation on the health crisis still continues. I'm still here with His Excellency Muthomi Njuki, the Governor for Tharaka Nithi, also the Council of Governors Health Committee Chair. But also joining me on phone now is His Excellency Mutahi Kahiga, Governor for Nyeri. He has issued a stern warning to his medics saying that their salaries will be stopped and they'll be summarily dismissed. Governor Kahiga, how will that help stop the strike?
Maybe we should start and begin by saying we cannot sit and watch our people die and suffer while our doctors are on the streets demanding for what we are calling as counties ambiguous requests, because as far as the 19 out of the 19 issues they have raised, counties have met their end of the bargain. We have done promotions. Most of the counties have given what we call, right now I'll speak about Nyeri. Nyeri has given them medical insurance. We have promoted our doctors. We pay them their salaries on time. We allow them to go for training when they so require. As we are speaking, 18 are already in universities. And the issues that they continue raising are issues that must be handled by national government and not county government. For example, we don't post interns. We don't even pay them. When it comes to issues about payment of fees, that is a national government issue. So the only reason I think that is my doctors have really almost no reason, because when we question them, they say that they are doing it in solidarity with others. And so for the last 25 days, we've been pleading with them to go back to work and treat our people, whatever they have.
I think we've lost Governor Kahiga there. Governor Kahiga, Mutahi Kahiga was on the road, he mentioned earlier on, and he says that those are ambiguous requests. But, you know, Muthomi, His Excellency, when I come to you on this, the doctors are saying that some of the counties, 11 counties to be exact, don't have medical cover for their medics. Is that fair? Some of the 11 counties that they're saying? Or are you saying this should be a county per county issue?
You know, it's like I would like to insist that you've actually answered yourself. If out of the 47 counties, only 11 counties don't have enhanced covers, then where would the other 47 minus 11 be striking for the same reason? That is why Mutahi is calling it a bit ambiguous. The issue of the enhanced medical cover, there are two sides of the story. One, a human life is a human life. Whether you're a driver, whether you're a doctor, whether you're a cleaner, it is the responsibility or the mandate of the employer, in collaboration with the employee, to somehow provide a medical cover which can give them more or less a peace of mind as they work. And therefore, it's not an issue that is only restricted to the medics. It's only that my support staff, my drivers don't have a union. I mean, when I say that it's cuts across all counties, they would also be on the street for that reason. And therefore, it's an issue that cannot be treated in isolation for the doctors only, or the clinical officers. It's something that the counties need to handle in terms of ensuring that they have uniformity with all the employees.
Yeah.
And when you talk about the issue of the promotion, as much as we are doing it, if you look at what the SRC has provided, it may be a bit difficult sometimes to have a promotion that puts some professions above the job group of other cadres. There's need to ensure that an accountant, an architect, the guy who does public health, all of them, when it comes to the salary scale, if you are a job group M, it should be having the same remuneration across the board. But now what is being pushed at the moment by the medics, because they have a union, is one that can easily find themselves having a pay that is way above the rest of the cadre, especially because of their allowances.
Okay.
And therefore, it is something I'm sure even SRC is cautious about.
Yeah. Let me bring in back Governor Mutahi is back with us on phone again. Yes. Governor, you were explaining something, but my question here is, where will you get this new workforce if you fire every doctor there?
maybe then what I will tell you is that I will only fire 60 of them and hire 60 or even more. Because the fact that they continue being on the payroll, they are working on the streets, does not give the county any room to hire. But now once we take action, we have asked them to go back to work. They have a small window. If they do come back, then we will continue. If they don't, then we will have no choice. We will follow the laid down procedure. We will relieve them of their duties and we will hire new doctors. There are in fact very many in the market. And many have even started reaching out to us, telling us they would want the jobs.
But Governor, you're part of the health committee. What is the best way of dealing? What is the best way of dealing with this standoff that is now entering day 26?
The best way of dealing with this standoff is simple. We recognize the right of employees to join unions of their choice. But then unions must also remember that unionism is about a give and take. The president himself was able. He made an offer of 2.4 billion, which they have rubbished. Instead of taking that one home and then fighting for the other. You know, Trevor, I have been a unionist, and we survive by taking home what is offered on the table.
All right. I apologize for that again. I believe we have enough from His Excellency Mutahi Kahiga there. And I was asking him, where will you get this new workforce, even if that is the direction that the Council of Governors takes? Yeah.
You may be aware, or you may not be aware, Trevor, that as a country overproducing medics, that is why there's been a conversation around exporting a workforce for the medics. One of the reasons why the national government is having hardship in paying for the internship is the numbers have increased tremendously. Remember, initially we used to have a very few universities that used to offer the medical courses, especially for the doctors. At the moment, almost every other university in Kenya is offering the medical course in various cadres. Don't forget about the private and even the one that's out of this country. That is why you find the number that used to be there before. Maybe they used to churn about 300, they churn about 800. Now they're churning much more than that. And therefore, the issue of being able to afford with the same economic situation or even worse is a big problem. Every time I advertise for medical officers, I get 4 times
the number that
I require, or sometimes even 10 times, depending on exactly what I'm looking for. So they are there.
Governor, hold that thought for a bit. This is a very hot topic. I'm being told now that the KMPDU Secretary General is also calling in. Davji Atela. Davji, are you there? And what is your reaction to the statement by Nyeri Governor Mutahi Kahiga that your striking doctors will be fired if they don't go back to work?
Thank you so much, Trevor. I think that Governor Mutahi Kahiga is a former unionist, and I think he has more knowledge regarding the labor movement, and he is at the point should actually advising governors on the best way to deal with labor movements rather than dealing with threats. Because one, for sure, he knows very well that the doctors who are on strike are striking for good reason. I sat with Governor Kahiga Mutahi and Governor Mudomi Njuki and 10 other governors and the CS last year and signed an agreement on the issues of collective bargaining agreement, the matrix that was to be implemented. We didn't have any other meeting to have these things implemented. The Nyeri doctors are owed 7 years basic salary arrears. That has not been paid. So ideally, as a unionist, I was expecting him to actually threaten these doctors by paying him those arrears and saying, oh, we have paid the arrears. Now, why are you still on strike? And again, it is really a sad situation that him as the chair of the Labour Committee and Excellency Mudomi Njuki as chair of Health Committee, they all joined the governors and the government walked out of the negotiation on 27th. So I realize that the government should not have a double speak of dealing with this issue with threats on the streets or in the media. It doesn't work that way for unions.
But Davji, hold on one second. The governors say that they have held their end of the bargain. This is a cross-cutting issue on the CBA where the national government is also playing a part, but they have held their part.
Which governor has paid doctors the big salary arrears for the last 7 years? Not a single one. And that's why you saw a letter from the COG asking the national government to release for them money. They have not paid it, they have not planned to pay it.
But they say they can't afford it.
And I would ask you, Excellency Muthoni Njuki, who is there, that did we sign an agreement that this was to be paid last year and it was sorted out? Today it has been sorted out. In fact, there was 3.5 billion, all the 47 governors, none of them has paid. That is one. Number two, we're talking about the shortage of doctors across the country. None of these counties have employed doctors, and the shortage there is immense, to the point that if the governor says that the country is overproducing doctors, it is a downward element, in the sense that counties have not employed for the last 7 years, and those who are employing very few. There's a big shortage in these hospitals. Okay. And they're running at a minimum.
Okay, I'll allow. Yes. Thank you, Davji.
And see, just one thing, these threats that we are getting, we got threatened before. We had an issue like this in Laikipia and Kirinyaga, but one thing is that we are exercising a constitutional right.
But Kirinyaga actually went ahead and followed through with their threat. In fact, it's one of their demands for them to reinstate your doctors. So it means it is possible.
They have not just complied to court order. And I'm telling you one thing, it's more subjective on individual person. Okay. To assume that the governors are there for time, but then the civil service the doctors offer are there for perpetuity.
Okay. Thank you, Davji. What is your reaction?
Well, as a matter of correction, I am not saying Davji is totally wrong, but probably 5% of what he's saying is the truth. 95% may not pass the test of the day. Because when he says we have not employed, we have statistics that shows for the last 3 years, the Council of Governors collectively as counties have employed a total of 890 doctors in that cadre, leave alone about the clinic officers and the nurses. It's there. I can give him a list tomorrow. Let him talk to me. I will give it to him. When you talk about promotions, we have 1,705 across counties have been promoted, including Tharaka Nithi. And therefore, we cannot say in a blanket that we are not doing any promotion. But
He claims there are 7 years arrears that have not been paid.
That I'm coming to it.
Yes.
He's talking about the collective bargaining agreement where we had the basic pay, which was part of the collective bargaining agreement, which, one, the SRC took a bit of time to provide the roadmap on how exactly it's supposed to be paid. Because when you give a new job group to a certain cadre of employees, it is very important for you to give what will be the starting salary or starting remuneration for that particular job group, and then consecutively, what will be the yearly increment. As we sit here, SRC only provided for the beginning, does not have what will happen to the rest of the years. And most important, and I want you to note this, Trevor, if you go to the CBA, the total resources that are required, remember a CBA is injecting a new demand in the market, where we say now, if we have been dealing with HR to the counties is costing this much. So it will all of a sudden increase the demand for how much counties should be able to spend on HR. Where does county get resources? The county gets resources from the equitable share. There should have been an equal arrangement to ensure that this collective bargaining agreement that has been signed and supervised by national government should ensure that there are resources that have followed the function to the counties to ensure that, yes, we have said pay doctors more money, pay them their arrears, and this is how you'll pay them. This year we'll give you this amount of money in allocation, the next year we'll give you this much, and all that should now remain constant to ensure that you take care of all those doctors. Probably they could say going forward, then when you recruit new ones, you should be having in mind, this is the job group where they'll be entering, and this is how it should be done. That did not happen.
Okay.
And there's documentation, even in the collective agreement, to show where the money was supposed to come from. It was not supposed to come from counties. It was supposed to come from the equitable share, the exchequer, which is not controlled by the county government. Okay. I'm not saying the national government are the ones who are supposed to have been paying. But if, as a country, we agree that we are going to have an extra 30 billion per year, 10 billion per year,
Yeah.
There must be in the budgeting process that is of the whole country to show where that money is coming from. It was never provided.
This conversation is quite heated now. I'm also being informed that another unionist, Peterson Wachira, is calling me now, the Kenya Union of Clinical Officers chairperson, Peterson Wachira. Peterson, good evening. What is your concern with the counties specifically?
Good evening, Trevor, and thanks for bringing in the governor. I've been looking for him for quite a long time. I've not been able. And what I would like to know, number one, is why the Council of Governors, and where he represents as the chair of the Health Committee, has actually defied a court order to come to the table, conclude the CBA, which is actually the reason as to why the clinic officers are on strike. And the second thing, I would also like to ask the governor so that he can also explain. We have gone to the Ministry of Health. We have been informed that for the universal health coverage staff and those COVID-19 related contracts, that actually the Ministry of Health has the budget and has the will to put them on permanent and pensionable. But then the Council of Governors is of a different opinion. And we wonder why that should be so when there is actually a budget, and why the Council of Governors would want staff who have been working for them and who are heroes and heroines, having fought COVID-19, should continue suffering under contracts where they are earning 50% of what their peers are earning, when they are actually just supposed to give a nod and agree to what the ministry has tried very hard to achieve. The other question I would like to ask, and noting very well that where His Excellency Muthoni comes from in his county, he has actually put all his clinic officers on permanent and pensionable. But then we are having these, in so many counties, there are so many irregular and indignifying contracts. And an example I would give is of Kiambu, but there are many others, where you have actually clinic officers being paid 4 different types of salaries.
Okay. So, Peterson, just for clarity purposes, if you've said that Governor Muthoni has put his people on permanent and pensionable, so why is he carrying the burden of the rest of the counties then? Or are you saying that you are not striking in Tharaka Nithi?
No, I'm not saying that that is the only thing that is taking us on the strike. I'm saying that he holds a higher responsibility as the chair of the Health Committee. But there are many other demands that concern the county, from the CBA, from the enhancement of the risk allowance, from the issue of the UHC and putting them on PNP, because actually the Council of Governors is the problem on these issues.
Okay.
And I think lastly, I would want to ask the governor, what does he think would bring in the stability in the health sector? Because we have seen that the instability is from ineffective management of human resources, where you get there are a lot of disparities emanating from issues of different pays, irregular contracts, issues of failure to promote, failure to redesignate, and this happens across the country. And we have given our solution, but what is the solution of the Council of Governors?
Yes.
Because they have opposed our solutions in the past. What is their solution?
Thank you, Peterson. Peterson Wachira, the chairperson of the Kenya Union of Clinical Officers. He has 4 questions for you.
Yeah,
One, why is the Council of Governors defying a court order and not coming to the table to conclude the CBA?
Well, I don't think that's really a question, as it were, because it is not a question of if, it is a question of when. Because the issue of the court orders has been a very evasive issue. They become more or less like musical chairs. The doctors say that the Council of Governors and the Ministry defied court orders to implement the CBA. All right? The doctors were given a court order, and in particular in this latest court order, order number 6, where they have been told clearly by the judge, for avoidance of doubts, they should suspend the strike, even as we continue finding a solution to this, which they haven't.
Okay.
All right?
So 2 wrongs make a right.
And you look at the clinic officers also, they say we have not implemented the court order to be able to come on the table and discuss the CBA. But you know, all those things, forget about the fact that this feeling that court orders have been defied. All those things at the end of the tunnel, if you remove the veil around all those things, it is nothing else but financing. If the finances were there for the national government, for the county government, for any other stakeholder who is involved, including Salaries and Information Commission and PSC, because all of them at the end of the day, before they make a move, that is why we normally say that any implication that involves commitment of resources requires further engagement with not just the stakeholders. And remember, in Parliament, they say any money matter must come to the Committee of Finance and must come back to the floor of the House. Why? Because it involves a permanent change in how you spend your money. There must be a resource for that. So all these things that we are talking about here, we are even looking at see if we have a standoff with our doctor. This is nothing else. Money, my friend. So you should be asking yourself, how do we finance health in Kenya?
We are part of the Abuja Declaration.
That is part of the big question.
But
the Abuja Declaration puts it at 15%.
Yeah.
In Kenya, we are shuttling between 9 and 10% most of the time. And even that, it may not be having a good allocation where we say the human resource, which is very critical in controlling all the resources, must have this ring fenced for them, while the rest goes to infrastructure and commodities. That is not the case. So it is 9% of you take it and deal with firefighting. When you plan and you just want to spend this on commodities, if the doctors make a demand, forget commodities, run to them. When they are better off, do an OPD, you know, that kind of thing. We need better planning.
Wachira is actually asking you, what will stabilize the health sector from the Council of Governors?
Well, we, as all the stakeholders, must, and I'm going to talk about the stakeholders, I'm talking about the national government, talking about the Public Service Commission, the SRC, the Council of Governors, and the employees themselves must have a conversation about money and the wage bill. And that is why I think next week we have a conference on wage bill, which is organized by SRC. There will be a lot of discussion on that. By the way, at the moment, Kenya, we are spending about 45% of our resources, almost 50 on wage bill, while it's supposed to be at 35%. Out of the 2.3 trillion that we are able to generate as a country through KRA, 1.1 is going to remuneration. Is it something we can afford? We just have to reorganize ourselves, put our priorities right. Because every other talk around all this is just an exercise in futility. Because which governor, which president will say, I don't want to pay my doctors, I want my people to die? None. It is a question of affordability. And that is why we need that to have conversation around monies. What do we do with this issue of financing?
There are two other questions that he asked you in the UHC and COVID-19, but like I said, Governor, today everyone is calling. Nicholas Odipo is also on the line, Chairperson NUMLO, that is the National Union of Medical Laboratory Officers. And Nicholas, what is your concern with the counties?
Good evening, Trevor.
Yes. Good evening.
And thank you for giving me this opportunity to ask my questions.
Yes.
Now, I'm hearing the governor talking about issues of affordability and maybe the wage bill is going up. Why is it that when matters health is talked about, is when now the country starts to bring issues of wage bill, issues of affordability, and so on and so forth? Because right now, if you look at the reports that are coming out from the Office of the Auditor General, you find that most of the counties, their priority of how they use the money are not priorities. Someone buying a seat of around 600,000 and an umbrella of 3 million and a digital watch of around 700, 800,000. Then, when issues of healthcare workers, you talk about affordability and the wage bill. That is question number one. Question number two. In 2017, when the Kenya Union of Clinical Officers went on strike about their recognition agreement, their recognition agreement was signed at a central place at the COG. Now, in our case, as Kenya National Union of Medical Laboratory Officers, we are being told by the Council of Governors to go to the 47 counties to sign a recognition agreement. Why is this different, and why is this discrimination? Because if you look at Section 20 of the Intergovernmental Act, Council of Governors is supposed to do issues of common interest to the county. That is one of the functions.
Okay.
And the recognition agreement is an issue that is a common interest to the county, because the members they represent are working in the counties. So why is it that they are being pushed to go and do the recognition agreement in the counties? And see, when matters, and especially recently, they came up on a resolution on how they are going to deal with the UHC workers, whereby they say that they will renew the contract of UHC in local terms. And they did it as Council of Governors, not as individual counties. So why is it that when we want something from them, they give us their back and tell us to go to the counties, and when they want to do something that is against the law, that is against the healthcare workers, they tell us to they do it as a group. That is Council of Governors.
Thank you, Nicholas.
Finally,
Nicholas.
Trevor, the issue of promotion and redesignation of healthcare workers.
Yes.
As we speak, Tharaka Nithi county government, which the Honorable Governor is the governor of that county, has not promoted workers since 2019. If you look at counties like Nyamira and Kajiado, they have promoted on the paper, but they have not paid their healthcare workers. If you look at a county like Garissa, a county like Garissa has not promoted their healthcare workers for the last 12 years.
Thank you,
Nicholas. They have not been paying leave allowances for their healthcare workers for 8 years. They have not been paying uniform allowance for the nurses for 4 years.
Thank you, Nicholas. That's Nicholas Odipo there. Thank you. Thank you so much.
About this,
thank you so much.
And they are done against the union.
Thank you, Nicholas. That's Nicholas Odipo, Chairperson NUMLO. That is the Kenya National Union of Medical Laboratory Officers. There's this issue, Governor, of UHC workers and renewing their contracts.
Yes.
It's also part of the issues that Wachira raised at Kenya Clinical Officers. Let's start with that.
That issue is raised across all the three cadres that are striking, the doctors, the clinical officers, and now the laboratory technicians. It's a very simple issue. Around the COVID, the national government, without any consultation, somehow decided, and I'm not saying it was a bad thing because it worked for us. It was an emergency. It's part of what we were doing as emergency response. Decided to employ medics to be able to mitigate the COVID-19 because we never knew what was going to be the effect. And therefore, the terms of employment was contract for 3 years. It was supposed to also be a different job group from the usual job groups, which they were earning almost 2/3 of what the rest were earning. And it was supposed to be only for 3 years, and after that, they were supposed to work home.
They are saying you are supposed to absorb them.
No, that is the assumption. Because the moment they were given those jobs, and I want us to be sober when we discuss this. First and foremost, Trevor, you know, employees in Kenya are usually very interesting. I don't know if it's Kenya or the whole world. When you're taking a job, you willingly sign and agree to the terms and conditions, and you're very happy. You report and you're very happy for the first 1 or 2, 3, 4 months before the union officials approach you and tell you, know what, here you are being taken for a ride. Somebody of your job group is supposed to be earning this much. You know, all of a sudden you have somebody who gives you advice and you decide, now my demands are different. Yet you signed and agreed. I agree to these terms as much as I understand them. Now, to cut the long story short, because I understand what I mean by that, because even those workers you talk about in Kirinyaga, in Nyeri, who have contract, do you think anybody was forced at gunpoint to take a job in terms of contract?
Yeah.
You advertise. I personally advertise. And I say permanent and pensionable. I advertise and say contract. There's a time I advertised for specialists in using contract. I did 3 advertisements. Nobody turned up. I was told the problem is because they want permanent and pensionable. I went there. But what if I advertise and they apply? I give them. Because the contract also has its own advantages. Because when you're working under contract, because you want your contract to be renewed, you work harder, you know, and also you deliver because you want your contract to be renewed, and therefore you earn another term and so on and so forth. There is also a possibility that when your contract, you may not have time for very petty issues, you know, because you're a focused person. Some counties prefer that.
Okay.
So when that happened, what happens after 3 years? COVID is gone. These staff, they are in our facilities. Some of them man facilities on their own. And therefore, it is a question of the national government asks, do we need these people? Yes, we need them. And they say, can you take them over? Man, how do we take them over? Because you look at the money is involved. Like I told you, money, resources, is supposed to follow functions. When they were employed, there was a kitty. That kitty should have been transferred to the county government and say, we have given you, actually in total there are 8,000, around 8,900 of those UHC staff. They're supposed to say, these 8,000 staff are earning this much. And therefore, in your equitable share from the exchequer, we are adding counties this year, this amount of money. And that was one of the demands we made when we were justifying our allocation to be increased to 450 billion this particular financial year. We wanted that money to be provided so that we can be able to take care of that. So if the resources are not available, what do you expect counties to do? You know, we are beeping a sieve. Counties usually get their resources from the county. You know, it is a kitty because the taxes that are paid in Tharaka Nithi County end up, except this what we call own source revenue, the one that is paid in form of cess. All these are the taxes that you know are collected by KRA. They end up there.
The national government.
So that kitty is supposed to ensure that we also fund functions that are being implemented in the county. When we increase the number of functions, then we should also be able to increase the amount of money. The problem is those resources, my friend, have not been provided. They are not there. Counties, yes, they are the ones that have got the employees who currently are being paid by the national government. We have not taken them over. But they are being paid by the national government at the moment. The national government says, after this, take them over. But how will we take them over if we don't have the resources to pay them? And allow me to...
But that statement of not having enough resources has not stopped the strike. So how does this whole strike end?
Well, it's a conversation, and some of the doctors may not be realized that all of these issues about resources. They are just told, well, money is being used to do ABCD, like my friend is talking. Yet you're not being given your promotion and all that. They must understand everything's to do with resources and policies that affect almost everybody in Kenya. So we need to address the issue of finance.
Resources. Thank you, Governor. Thank you so much for making time for us. His Excellency Muthomi Njuki, Governor Tharaka Nithi and Chairperson, Health Committee at the COG. We're taking a quick break. We're back with more in just a bit, all right? Thank you, sir.